In this video, I want to share 3 foam roller exercises that you can do, or if you're a physical therapist, you can have your patients do to improve their hip internal rotation. So when I'm discussing internal rotation during this video, I'm doing it from more of a source-based approach. The symptom is the femur, and that's what we're typically familiar with. A lot of us check internal rotation by bringing the femur to 90 degrees, internally rotating it, and then writing down the measurement. Now, what we're talking about will improve this measure. When it comes to the isolated measurement, a lot of times patients can't get that internal rotation because from an isolated standpoint, when we internally rotate, we have to posteriorly glide. So the femur has to be able to shift back, and a lot of times it can't do that from restrictions at the joint capsule and muscles surrounding. And so what we are doing in this video is talking about how to improve internal rotation from a global perspective, but because that global perspective, we get the local outcome, meaning we will still see improvements in that hip internal rotation. Now, what am I talking about when I say this source-based approach? Well, we're just talking about the pelvis and more of a closed chain approach. So an easy way to understand internal rotation from the pelvis standpoint is looking at gait. It's represented by the mid-stance phase of gait. And what we see is the big IR bias. So we have the foot going into internal rotation. We have the femur going into internal rotation, adduction, and extension, right? So we have these big time internal rotation measurements. Well, we can simplify that by understanding that during this phase, the pelvis is starting to turn. And when the pelvis can turn optimally, then the person has the ability to go into internal rotation. If they don't have the ability to do that, then they start to compensate, usually through the spine, but you can also see from the hip, the knee, the ankle, right? So what would allow them and not allow them to achieve internal rotation? Well, we're going to flip the pelvis around to understand it. What needs to happen is as the person turns, so as we turn, this right side here is going into external rotation. This left side here is going into internal rotation. Notice what happens here. The space needs to increase. When that can happen, we can optimally get into that left side to then internally rotate to push back out. So what I want to show you on the foam roller are 3 exercises that are really going to help to open up this back posterior outlet so that your patient can not only improve on their global internal rotation and their ability to turn and rotate, but also you'll start to see that at the local level as well. So the first exercise is a foam roller piriformis stretch. Now remember, all of these exercises has the one common goal to open up that posterior outlet to allow for normal internal rotation to occur. Now when it comes to the piriformis, a lot of people forget that it's actually an internal rotator right around 90 degrees of hip flexion. And that's because the line of the pull changes as the femur continues to flex. So what we can do is go to about a 90-degree hip flexion angle and then stretch the piriformis, but really the goal is to kind of dynamically move in and out of internal rotation. Now, a foam roller is great. If this is too much for the patient, you can do it on a box, a bench. The higher up, the easier it's going to be. The lower or closer to the floor, the harder. So what you're going to do is just have your patient put their leg on. If they can get their leg down, great. If they can't, no problem. And then all we're doing here is a couple things. We are trying to draw that left pocket back. Every time I draw that left pocket back, we are expanding and opening that posterior outlet. And you should feel it when the patient does it. So as they go back, you can feel that. And then as you push forward, you drive more hip flexion. So you're going to get more stretch there as well. So this is a great one. I usually like to time this for 60 seconds where they're moving in and out of that internal and external rotation. Exercise number 2 is just a dynamic hip internal and external rotation. So what we're going to do here is actually be on the very edge of the foam roller. So you can slide that over. You're going to put the side that you want to work on top of the foam roller. And then all we do from here is go into a quadruped position. So this right knee is off. Come forward a bit, and all you're going to do is drive that right knee down and bring it back up. So as you go down, you should feel a back pocket stretch, and as we go back up, you should lose the stretch. So it's a great exercise to really open up that joint capsule, let the piriformis, let those external rotators stretch, and really move in and out of internal rotation. What I would say is you want to make sure that the patient keeps that right knee pretty close to the foam roller and doesn't just bring it on out, especially if they're really limited. They might just let them sink into it and feel that, but really internal rotation by driving that right knee down so that left posterior outlet opens up. So our third exercise is a foam roller split stance lunge. Now this is definitely more on the strength side, and you can use a normal size foam roller, but also a smaller kind of half size foam roller also works really well. Now remember, the main intent is to open up the back posterior outlet. And I'm going to show you using my right side, right? So if you wanted to address the limitation, it's going to be the side or the leg that's touching the foam roller. So all you're going to do is place the foam roller on the wall, put it right above the knee, again, the knee that you want to, and the leg that you want to improve. And then all we're going to do is go through a lunge. But there's two things that bias internal rotation. The inward push is going to get adduction and internal rotation of that femur. But also, we are going to have our arms kind of cross body. So you can think of this elbow being in front of the right knee, and this arm goes back. That turn is going to help to bias internal rotation, create space, and open up back here. The last thing I'll say is you want to keep a neutral shin angle. So neutral shin angle just means the knee is right above the ankle. So we don't want to be super far in front of the ankle with our knee or super far back. Both of those will actually bias a little bit more of an external rotation position through the lower extremity. So all we do from here is just a normal lunge, right? So we turn. We're going to drive into that wall. We should feel that back pocket area of the leg we're working. And all we're going to do is start to go down. We can think of breathing, inhale on the way down, exhale on the way up. But as you go down, you should really be driving in and feel that back pocket. And then you push on out of it. So this is a great one to really work more on the strength side to learn how to truly get into that internal rotated position.